This podcast is from the team at Healthcare IT Leaders, a national leader in IT consulting and workforce solutions serving top U.S. hospital systems. You can support our show by leaving a 5-star review on Apple, Spotify, or your favorite podcast platform. Thanks for listening. Now here's our latest episode.
There's a lot of stuff around finance and strategy and all those type of things, and that's very, very important. But building effective teams and understanding your own self in order how you are a leader, and understanding that, people are observing you. You have to walk the walk as well as talk the talk.
From Healthcare IT Leaders, you're listening to Leader with Ben Hilmes. Our guest today is Chuck Christian, Chief Technology Officer at Franciscan Health. Chuck discusses his team's pioneering move to host Epic in Microsoft Azure, the financial discipline behind cloud cost management, and the strategic role of virtual care. He also reflects on decades of leadership in healthcare IT, emphasizing humility, teamwork, and the importance of asking the right questions.
Welcome, Chuck. Glad to have you today. We are going to cover a lot of topics in the next half hour. You've got such a diverse background. The stories you can share are going to be really, really valued by our listeners. So you've been a CIO. You've spent a large part of your career around interop, which is a very important topic at the largest information exchange in the country there in Indiana. And now you're at Franciscan Health wearing the CTO hat. So maybe we just start there. Talk to me about Franciscan Health. Talk to me about the CTO role, and then we'll dive off from there.
I've known this organization for a very, very long time. The previous CIO was a good friend of mine, Bill Laker. Bill and I, we ran the same stack of software. I was a CIO in Southern Indiana, and Bill had a much bigger system, so he had a bigger stick when it came to helping us mutually convince our vendors that they were incorrect and needed to service the organizations a little bit differently. And so I got to know Franciscan really, really well. Deep regard and respect for this organization and the mission of servicing the people that need healthcare. Every organization needs to make money, because without a margin, there is no mission. But we really work hard to service a population that otherwise would not receive healthcare. So as being in the CTO role, people say, well, Chucky was a CIO. Why do you want to be CTO? And so a couple of things is I like technology. I've been around a long time, but I love what I do. And I have an outstanding crew. I get to work with some of the smartest people, and we've done some really interesting things. I have a tendency to ask difficult questions. My team has learned that, I'm not pointing a finger. I'm a curious guy. I'm typically the guy in the room that asks the stupid questions because I'm just a dumb old country boy from Alabama. And it's not because I want to pry. It's just because I really want to learn. And I think that, we're put on this earth. If we're not learning every day, we're missing an opportunity.
So you've done something that's, a lot of people are contemplating, and that is moving my Epic, platform to the cloud. And you chose Azure. Yep. And I know it's a journey, right? But I'd love for you to share a little bit about what drove that project? How did it go? What were some of the outcomes? Some people think, it's going to have this massive return on investment,
right?
All of those things. Just curious to see how you guys built that framework of thinking and then how the journey went.
It sounds more romantic than it truly was. I actually had hair when we started. So no, I'm just kidding. It truly was a journey. And it took us about 18 months to get there. I think that, we learned a lot of things. When I first joined Franciscan back in 2019, one of the gifts that Bill gave us right before he retired, he signed an agreement with Dell Technologies, which is VirtuStream. And we were the first customer to host in Dell data centers. I joined in April of 2019, and we transitioned to their platform in May. I got to take credit for it. And, we had a 5-year agreement. We were going to re-sign with Dell VirtuStream, but they made a decision they wanted out of the hosting business. And so that gave us an opportunity to do something else. And so, Charles and I had a lot of conversation about that. And actually, Charles decided that we were going to the cloud because we knew that we were going to wind up there eventually. Why take an interim step? Let's just go. And we knew that nobody our size databases and stuff had moved to Azure. Microsoft was telling us, yeah, you can do that. Some other folks that, good friends of mine, CIOs, were moving to AWS for a variety of reasons, but nobody had done it yet. We've been first a couple of times, and we played the pioneers, and you know what pioneers get, don't you? You get the arrows. But I have a great team. You mentioned ROI, and everybody's asked me, "Well, Chuck, how much money have you saved?" And I just look at them. I says, "Well, just go ahead and get your Prozac out because you're a little delusional." Because if, anybody that's doing this and has moved any large infrastructure to the cloud understands that over time you may see some savings, but the savings is not because you just moved to the cloud. There is no magic bullet to that. The magic comes in as being able to manage the cost. So what I did is I created a position called a cloud cost analyst. And I had an analyst that worked on the infrastructure side that was doing a lot of work, and he was just great with details. Cloud costing is extremely difficult to understand. It's almost as bad as licensing, is that there are so many options and so many things. You can have reservations, you can have quotas, you can have all this stuff, but if you're not watching it every day, you're going to be caught with your pants down. And I will say that between my cloud cost analyst and the consultant that we brought in from another company that knows how to do the Power BI and pull that data out of Azure so we can visualize it, we've saved multiple hundreds of thousands of dollars a month. And so you're talking millions of dollars a year. I mean, Eric and team, I get a weekly report about what our estimated spend is going to be. I share that with my boss, and I share it with our financial partners. We have two guys that work in finance that are our partners. We have a transparency on cost in the cloud like we've never had before. And we can predict what our cost is going to be. I spent 20, 25, 26 years trying to predict what my cost is going to be running in my own data centers. I couldn't do it. I could estimate it, but I couldn't predict it.
I love the advancements. I love that, you're trying to simplify a complex thing. It feels like
that's because I'm just a dumb old country boy from Alabama. It has to be simple.
But you've talked about workload placement strategy, and I think that's what you just walked us through, which is, right assets, right place, right time, and trying to figure out that constant maneuvering of those assets to, manage cost, quality, time, et cetera.
Right. So we did what we called a workload placement review, and we did it kind of, followed Gartner's approach to taking a look at it. It's kind of the 4-box approach. You've got some stuff that it just can't move. It's got to stay in your data center. It's got to stay on-prem. I mean, those are things like inference security for your fetal monitoring. Those things have to be there. And then you have other things that have to have edge servers like PACs and those type of things. But then you have other things you can consolidate. One of the things we did is we consolidated having all the hospitals and having all the critical cares. We had servers for our cardiac monitoring in each one of those facilities. Well, didn't have to have those. So we consolidated those and we shut down about 75 or 79 servers, and we could run all of those. Actually, I have to run 2 sets because of time zones. But we moved them into a data center. And so I asked Philips, I said, so can I run that in the cloud? They said, oh, sure. You want to be first? No. And so I'm going to let somebody else be first.
You seem to like being first on some of these things. Yeah.
I want to keep the rest of my hair. I mean, the thing about it is, when you're talking about something as critical as your cardiac, you've got your sickest patients that are being monitored. I'm not fooling with that. That's a dice roll I'm not taking. And I have a great partner in the administrative director of HMT, clinical engineering, whatever you want to call it this week. She's great, got a world of experience. And we've done a lot of consolidation on a lot of different things. We just are wrapping up consolidating the biological monitors for all of our cardiac labs. That was also a big one. We changed out all of our integration in all of our ORs with a different piece of technology, which is now owned by Philips. Same thing with our vents. And so we're trying to standardize and consolidate. And hopefully in that, it simplifies a little bit.
That's great. That is great. So pivoting a little bit, you spent a lot of your career or chunk of your career focused on, and actually when you opened, you started thinking about interoperability back in the 80s. And then you migrated at some point in the middle of your career to the Indiana Health Information Exchange.
Yep.
Give us your perspective on, look, HIEs have, I think, provided tremendous value. Where are they today? Where are they going? Where do you see, that whole topic? How is that going to continue to evolve?
I'm not as plugged into that today as I once was, but years ago, I had the pleasure when Mitch Daniels was governor of Indiana, he appointed me to two different commissions. One I was able to serve on, the other one I was not, but it was related to, at that time, Indiana had 5 health information exchanges. They were trying to figure out, this was before high tech, this is before meaningful use, before all of that.
Right.
The one thing about it is the asset that Indiana has called the Indiana Health Information Exchange grew. A lot of the exchanges out there today were built because the government, and I'm going to use the word forced us to do that. It was a carrot and then the stick.
Right.
But in Indiana, a group of clinicians, physicians got together some 30 odd years ago. Part of the nuance of Indianapolis is you have all these large health systems, but they share medical staffs, and IU School of Medicine, they service a lot of those physicians, and their interns or their medical students service a lot of those hospitals. And so you have somebody that's pulling a rotation. At that time, it was Wishart, which is the county hospital, our safety net hospital. They were pulling a shift there in the evening, and then the next night they were pulling a shift at Methodist or IU. At that time, they were separate, and they were seeing the same patients, but they couldn't get the records of what happened the night before or last week. And so, working with Regenstrief Institute and some really interesting folks there, researchers, and they wrote the code for the Indiana Health Information Exchange, which just transitioned over to IHI over time, which they maintain it and they control it today. And I think that was one of the reasons that they were so successful. But they wanted to share that information from a clinical standpoint. And it was, very patient focused. And I think that was the genesis that made it so successful.
That's awesome. Let's land on one more. So,
okay.
It's interesting. You keep saying you're not a pioneer, but everything you do, you are a pioneer. And one of those is you spearheaded a lot of the CHIME CIO bootcamp efforts.
I wouldn't say spearheaded. I had the pleasure of teaching, of being a faculty member for about 9 years. So that was a great learning experience for me.
We always talk about, a leadership component in the Leader to Leader podcast. And I'd love for you to just give, a few comments around your work there with the CIO bootcamp, because I don't think when you think about leadership legacy, and you think about the influence you've had on so many CIOs that have gone through that over that 9-year period, I'd just love to hear your thoughts on that.
The beauty part about it is that one of the tenets that CHIME was founded on back in 1994 was the premise of educating. If you go back in the time machine, there really wasn't a thing called a healthcare CIO at that point in time. We were just starting to get there. They had some great leaders, John Glasser and a few others that were really instrumental in putting this organization together. And I've had the pleasure of being a member since the very beginning. Actually, it was 92, I think. I'm a charter member, and I've had the pleasure of serving on the board twice. And I got to work with other just outstanding CIOs in the country, made a lot of great friends. And the really fun part for me is some of the people that were even in some of the early classes, the cohorts of folks. I still run into them at HIMSS and at Chime, and to watch their careers, because a lot of them have gone on to be healthcare CIOs. Right. And I also know some folks that went through the boot camp and said, I don't want to do this. And which is fine. I mean, I think that's
fail fast, right?
Yeah. I mean, I think it's kind of an epiphany moment where you can learn is, hey, this is, I think I want to do this. And they go, no, hell no, I do not want to do this, because, the boot camp is not a shakedown cruise. We worked a lot on the softer skills of being a healthcare CIO. There's a lot of stuff around finance and strategy and all those type of things. And that's very, very important. But building effective teams and understanding your own self in order how you are a leader, and understanding that, people are observing you. You have to walk the walk as well as talk the talk.
There's a lot of words I could use to describe you: a leader, a teacher, a pioneer. But, through this dialogue, I mean, you're an absolute treasure. Chuck brings a wealth of experience to his role as Chief Technology Officer at Franciscan Health. Here are 3 key takeaways from our discussion. First, Franciscan Health was among the pioneers in migrating Epic to Microsoft Azure, a strategic decision that enhanced scalability, agility, and built a future-proof infrastructure. Second, Chuck introduced a dedicated cloud cost analyst paired with robust reporting tools. This initiative provided greater transparency into cloud spending and resulted in substantial monthly savings. Third, Chuck's leadership style centers on supporting his team rather than commanding from the top. His approach, driven by collaboration, curiosity, and continuous learning, has left a lasting impact on both Franciscan Health and the broader healthcare IT sector. So, what resonated with you most from Chuck's story? We'd love to hear from you on our social media channels, or drop an email on our website, healthcareitleaders.com.
Thanks for joining us for Leader to Leader. To learn more about how to fuel your own personal leadership journey through the healthcare industry, visit healthcareitleaders.com. Don't forget to subscribe so you don't miss any insights, and we'll see you on the next episode.